Hi everyone, my name is Dr. Susan Silveira and I work for NextSense. I have a few roles within NextSense. The first one is I'm the course director for a master's program that's offered through Macquarie University in affiliation with NextSense, and that's called the Master of Disability Studies. And our broad aim is to teach our students all about sensory disability and how to support people with sensory disability and how to lessen the impact on them and also their families and society in general. My other role at NextSense is to work in research, and I have several research projects going at the moment. The main one is the Australian Childhood Vision Impairment Register. The register, as we like to refer to it, was first set up in 2008. It's a project that was begun because we didn't know how many children lived in Australia with vision impairment. And that's really important information, and I'm often asked, how many kids do we have? And I guess sadly, in some ways, I can report some information, but I'm still a little bit restricted in other ways because we haven't captured every single child on our project yet. And as a service provider, we want to meet the needs of families, we want to meet the needs of children, we want to be able to strongly advocate for those needs so that we make sure that there are other services, the vital services like health, education, disability support. We're all working together for the greater good for that child and their family. So if we don't know how many children, we don't have even a rough estimate of how many children, how do we possibly do that advocacy? It makes it very difficult. Children with vision impairment are rare. We don't have very many children. And of course, Australia's a very big country, so they tend to be diversely located. So that brings challenges for accessing resources, knowing where support should be focused, even things like making sure there's a specialist teacher accessing a child in a classroom and supporting them in their literacy and their whole educational development and journey. So knowing numbers helps us plan for the current situation and services we need to provide. It also helps us plan for the future and making sure that we're bringing benefit and support to children right across Australia. It's also very helpful for government. Government does their best, there's no doubt about that. We're all trying to do our best for these children and their families. But if we don't know numbers, it's very hard to argue for services. It's very hard when there are limited funds to say that this group of people deserve services just as much as anyone else, particularly when the numbers are limited. Since the register was established, we have gathered data on about 1,400 children. We think at any one time, if we benchmark off the experience of other countries and what is reported from those countries, we think we should probably have between 3,000 and 4,000 children registered. But as I said, we have about 1,400. It's interesting as a researcher, and if you're a budding researcher yourself, when you go on your research journey, how hard it is when you start a project to go from the initial setup to actually getting data back from people. It's quite challenging. So it was slow in the beginning. We had to do the usual things like go through multiple human research ethics approvals, which took a while. Then we had to try and convince our stakeholders to help us, and we've had remarkable support from stakeholders, and it's all their goodwill that has helped us. We also had to work with families to appeal to them to give us their very precious data on their children and make sure that we promised we would keep that data safe and use it for good purposes. We have recently published a paper on 904 children, and it's kind of like a snapshot of the register findings and very interesting things. And of course, we've compared those to some of the international findings as well. So of those 904 children, about 60% are boys, about 40% are girls. And the most common age for a child to be registered is around about starting at the age of 5 through to 10. Some really interesting and great news is that most of the children on the register are diagnosed early, almost all diagnosed with vision impairment by their first birthday, and a lot of them are even diagnosed by 6 months. That means we've got really good diagnostic services, screening services and diagnostic services in Australia. That's a real tribute to the network of ophthalmologists and orthoptists and optometrists that we have, and also other specialisations, nursing, paediatrics, general practitioners, all those people that are spotting the signs that perhaps a child's visual development is atypical and needs further assessment. So that's really good news. We have had some other interesting findings that are perhaps a little bit different to some of the reported findings from overseas, and one of those is around a child's birth history. We know that preterm birth is associated with multiple comorbidities, and vision is included in that. But in our cohort of 904 children, about 83% of those children were actually born full term and of a standard birth weight. So that's a little bit different to other projects that have collected data on children with vision impairment who have been generally born a lot earlier than that. So that's a little bit of a standout for us. And I guess as our numbers grow, that might change, but that's an interesting finding at the moment. We have some children that have ocular abnormalities, congenital abnormalities of their eyes causing vision impairment. But we also have quite a few children that have what we call brain-based vision impairment. So in fact, their eyes are intact, there's no abnormality there, but it's the parts of their brain that are doing the processing of the information where the issue lies. So the three most common reasons for a child to have vision impairment on the register at the moment. The first one is a condition called retinal dystrophy. And that's a cluster of conditions. You might have heard of something like Leber's congenital amaurosis or retinitis pigmentosa. So they're types of retinal dystrophies that show up really early on, and that's the most common reason why our children have vision impairment. The second most common reason is really different to a retinal dystrophy, and it's called cerebral vision impairment, often abbreviated to CVI. And this is when the processing parts of the brain are not able to do that in a typical way, so that causes vision impairment. So that really shows how vastly different our children are. They're a very diverse group. The third most common reason for a child to have a vision impairment on the register is a condition that you might be familiar with, and it's ocular cutaneous albinism. So we know people that have albinism have a lack of pigment through their entire body system, and the eyes are affected as well. So they're the three top causes, and they account for about 50% of eye conditions on the register. And then the other 50% are a huge mix of all sorts of eye conditions. Some of them are very rare. Sometimes we only have one child registered with that eye condition. When we look across the cohort of children on the register, we find that the most common level of vision impairment is in fact a moderate vision impairment. So the World Health Organization describes vision impairment in different categories, and it's according to the level of vision loss or the standard of the child's visual acuity. So we have mild, moderate, severe, and profound vision impairment also covers blindness. So as I mentioned, the most common type of vision impairment that kids on the register have is a moderate vision impairment. And I think that's interesting. I think we suspected in the beginning we would have a lot more children who had severe through to profound. And my personal opinion is that's also a reflection of the wonderful eye health care that is afforded to Australian children. They're picked up early, and we get in and we start managing these eye conditions to minimise the impact on their visual development and the ultimate outcome for their vision. When we look at blindness, there's just under 20% of the children on the register are actually blind. So it's an interesting number. It's a little bit lower than we see when we look at research in other countries. We know a bit more about those children who are blind. We also know that there is a high chance that those children will have severe developmental delay as well, and other comorbidities. So again, it's really helpful to have this data to start predicting what's the complexity of the child likely to be and what's the services that the child perhaps will need. Another interesting finding on the register is we talk about the primary ocular diagnosis of the child, but we also look at their secondary diagnoses. And many children on the register have a secondary ocular diagnosis as well as their primary ocular diagnosis. The most common that we find in about 33% of children is nystagmus. And nystagmus is a rhythmical, involuntary eye movement. And it can be in a situation where the eyes move uncontrollably in a horizontal direction, in a vertical direction. Sometimes the eyes even rotate. Why is this important to understand? Well, the fact that a child has nystagmus will further disrupt the vision that they have. So they end up with layers and layers of complexity on their vision that will also impact on the vision that they can access. We also know nystagmus causes a lot of visual fatigue. And so that's another thing that we have to be thinking about when we're trying to do adjustments and adaptation for those children. We also look at the prevalence of comorbidities, and there are a lot in this population of children. Most children have at least one other comorbidity, some have 5 listed on the register. Things like hearing loss is very common in our kids. Cerebral palsy, epilepsy are common. So if you're working with those populations of children and they haven't had a vision assessment, it's super important that they do. Super, super important. I might share some reflections with you that you might find helpful and hopefully motivating as well. If you do work with families or you do have the opportunity for projects like this that gather health data. We gather lots of health data in Australia, and other countries do the same thing. What we don't do well is that data doesn't talk well to one another. We don't share data, and there's lots of reasons for that. There's privacy, confidentiality, all sorts of reasons why we don't. But it is so very important that we are able to access data. We can talk in an informed way, and one benefit for NextSense in having this data is that we have been able to tailor services. We've been able to say, where do these children live? What services do they need? What are the specific services they'll require according to the complexity of their eye condition and their other comorbidities? So it has had a positive impact on our service. It's also allowed us to really connect with our families and understand their experience. One of the questions that we ask is, well, it's not really a question, we just say, tell us about your child. This isn't all clinical data that we gather. We love to hear what the families tell us, and despite the clinical findings and the diagnosis and the journey that they've been on, families can be so very positive about their children and tell their children's story with pride and hope. And it's a really important part of having that person-centred approach to our healthcare and understanding that. So being able to gather data like this is super important, but as I mentioned at the start, we rely on the goodwill of people like yourselves to tell people about these projects and keep telling them and keep encouraging them. And we also rely on you to return data forms and be part of projects. So it really is a big collaboration that takes a lot of effort. Everybody's busy, everybody's time poor, and without that input from everybody, it's very difficult to gather that data. But we now can talk in an informed way, which we couldn't before 2008. We can advocate for these children, we can advocate for their families. We can talk to government in times like when the National Disability Insurance Scheme was being created and formulated, and other disability support schemes that Australia has had. We've been able to say, hey, there's a group of kids, they need support. We know with support they'll do really well, so please include them. And it's very hard for government to deny that support when we have data.